Cabozantinib is a multiple targeted tyrosine kinase inhibitor. It targets MET, it targets RET, and it also gets VEGFR2. So it has multiple different areas that it's going after, and for that reason it's been developed in different ways. So the initial looks in lung cancer were really focused more on the MET activity and the VEGFR2 activity. We know as a single agent, it has a response rate of somewhere around 10%, and that was from a phase 2 study. It was a randomized discontinuation trial, so a little bit different than what we're used to thinking about, but clear single agent activity. It's also been looked at in combination with EGFR inhibitor, and that trial was designed when we used to think that MET overexpression was a much more prevalent cause of EGFR resistance. So in that setting, this combination trial was designed looking at what was going to be the maximum tolerated dose. And the two drugs together with erlotinib and cabozantinib do cause diarrhea as a major dose-limiting toxicity, some rash, a few other toxicities, but really that diarrhea can be challenging to manage. But activity was seen in the initial trial, which was for patients who had already had erlotinib and then become resistant. So there was some activity seen in that setting, and now there are ongoing trials looking at that further. One study was done by the California Cancer Consortium looking specifically in patients with EGFR mutations. We don't know results yet from that study. And then there's an ongoing trial within ECOG, the ECOG 1512 trial, which is led by my colleague Joel Neal. And that's looking at EGFR wild-type patients and comparing erlotinib to cabozantinib to the combination. And that's accruing well, so we'll see if we have activity there. The drug's also active by itself, as I mentioned before, and because its activity in RET is hypothesized and also known to be true based on a publication of just a few patients, there's an ongoing trial focusing just in RET patients. So I'm not really answering the question of where it is now, but hopefully we know where it's going, and that's going to depend on the outcomes from these trials. So we'll see. So currently it's approved for thyroid cancer. There's also been a lot of excitement about the activity seen in prostate cancer, and that's been especially in the bone metastases. So ongoing study there. And likely we'll see that continues to be an active indication, but obviously the approval's not there yet, so we'll have to wait and see. Right now in lung cancer, it's in phase 2, and I think we'll wait and see what happens in the studies that are ongoing to see where it goes. It is approved for thyroid cancer, so it's out there on the market. I haven't tried to get it off label, not recommending that, but it's something to think about in the future. And I think as we learn more about the VEGFR2 tyrosine kinase inhibitors, there's still a lot of excitement about them. Still not sure exactly where they're going to fit in the lung cancer landscape. This is definitely one that will be a player there, but again, without the data from the studies, we don't really know.